All right, Veronica, are you ready? I think we can get started so that we have plenty of time for questions.
Sounds good.
All right, so welcome everybody to the webinar. My name is Tracy Pugh. I'm a senior manager for the overdose prevention program at Vital Strategies. And I also want to acknowledge my program officer, Veronica Vargas, who will also be helping, and we may have some other Vital Strategies staff join to help with answering any questions you have, and who have also been very collaborative and put in the team effort to develop this request for proposals, which we're very excited to do in partnership with PIT Peru. So this, next slide. So we're gonna go over kind of the nuts and bolts, a little bit of the framework and the parameters of this proposal, and get into a little bit of the selection, how we're gonna, the algorithm we're going to use to make decisions, and a little bit about the timeline, but really leave plenty of time. I'm going to try and leave plenty of time for questions. This webinar is going to go until 1, and I know folks will be joining. So just a bit of housekeeping. We are recording this webinar, and PIT Peru, our partners, will post it online. So even though folks may have missed it, or some of your partners or members may miss it, they will be able to access it online. Also, throughout the course of this discussion, please feel free to submit questions either through the chat box on the bottom or through the Q&A. You can submit them throughout the presentation. However, I will wait until the end to address the questions that are submitted, and then I'll also open it up at the end, open up the audio if I figure out how, so that people can verbally express any questions or comments that they might have. Again, leaving plenty of time for that back and forth. Please note that in addition to recording audio and slides, the Zoom also records written communications in the Q&A and in the chat box, even if they are sent privately. So any written communication done in either of those will be seen in the transcripts. I also want to note that there's going to be a frequently asked questions document that will be developed, incorporating questions from this webinar, but also incorporating questions that may have been sent via email to Veronica. Veronica is our main point of contact for this proposal, and is the point of contact to be submitting the proposals. So next slide. So yes, we're excited to do this community mobilization project for harm reduction services. Many of you may have heard or seen me or my colleague Alejandro Alves discuss this initiative and our work last summer. So I'm not going to go too much into detail about the general initiative with Uberphilanthropies, but I do want to highlight that our primary goal through this work is to reduce overdose deaths. And the initiative currently spans 2 states and a few cities. The work in Pennsylvania was launched in 2018 with a target investment of $10 million over 3 years, which we have been allocating and investing. And we, as far as timeline, we are about halfway through this initiative. And we intentionally allocated part of that $10 million for this proposal and for this initiative. Community engagement and community mobilization is part of our theory of change and one of the pillars of our work. And we saw your coalitions, the coalitions that PIT Peru, as a great opportunity to support community-based efforts and to build on the infrastructure that PIT Peru has already begun, and that your work has already begun to lay the groundwork for. So we are very grateful to have this partnership with PIT Peru to build on. And we are hopeful to have partnerships with several of you as grantees as we go forward. Next slide. So as you may remember, we wanted to first do an assessment, and so many of you may have seen the survey through SurveyMonkey. Our thinking was to first see where are the coalitions at as far as harm reduction services, and specifically where are the coalitions at and the communities that the coalitions serve are as far as student services, naloxone access, and police-assisted pre-arrest or pre-booking diversion. And the survey indicated that there is opportunity in several coalitions to conduct harm reduction work in these domains. We also went back and forth in how prescriptive we should be, but in the end, it's really the coalitions that can best decide for themselves the best approach. However, Pitt Peru and their technical assistance, as well as Vital Strategies, we are here to assist not only in the implementation, but also in the proposal development stage. I don't know how many folks have experience doing other grants, particularly the National Institute of Health, but we're kind of like program officers, the way the NIH has program officers. We're here to give feedback, we're here to give advice. So definitely use us, use Pitt Peru, ask questions early and often. And after we see proposal submissions, we may also provide recommendations for revisions or adjustments. So we really, really want to support you and support your work. And we also really want to ensure that the work you're doing is strong and impactful and aligned with our harm reduction goals. We really don't consider ourselves as traditional funders, but rather implementation partners. And so we don't just provide money and leave. We are often part of the design process for all of our grantees. And so with that, we are available to help answer questions and provide technical assistance. And we will continue after awards are given to be available to provide technical assistance, whether it's trainings or one-on-ones or troubleshooting or connection to other experts. So we will continue to be thought partners and implementation partners throughout the entire phase of this work. We do our work with a lot of thought and intention, with the primary goal of reducing overdose deaths, but also within principles of equity, within the framework of harm reduction. And with this short time and limited amount of money, we want to ensure meaningful systems change, meaningful narrative change, meaningful work as far as stigma reduction, and meaningful work in engaging and mobilizing communities. So this is about really driving real change at the local community level. So these are the basic parameters, up to $50,000, one-time funding, 12 months. You can choose to propose more than one harm reduction activity, although we will be looking at feasibility. So that is something to consider, to be strategic about when you develop these proposals. We do estimate that up to 15 coalitions will be funded. And again, we are here, Pitt Peru is here to assist in the development of the proposals and answer any questions you may have. Next slide. So this is the timeline that we're currently operating on. We do want to acknowledge that we are monitoring and aware of the changing landscape of COVID-19 and how it can very much and is very much impacting the work that we do. However, we do feel that overdose continues to be an issue, and perhaps even more so within this climate of COVID-19. And so we just want to emphasize that we are flexible, that this timeline and this work is by no means rigid or written in stone. And so we will try to be accommodating and field questions and concerns as best we can. And then I just want to note Veronica Vargas, again, is the main point of contact, not only the point to where submissions proposals should be submitted, but also any other questions or concerns you have can absolutely go through Veronica at bvargas@vitalstrategies.org. Next slide. So getting into the framework a little bit, and again, I know I spoke about a harm reduction framework last summer, so some of you may have heard about it, so I don't want to go into too much detail. But this is the framework that guides all of our overdose prevention work. And so it makes sense that this is also the framework that we would like to see within the RFPs. It is a harm reduction and equity framework. And so we just want to see in your proposals, intentions, in your consideration of inequities, and how you're identifying them, how you seek to address them, time and time again when it comes to our societal responses to drug use. We see that Black people and other people of color, people of low income, people who are sexual minorities, and other marginalized populations are often left behind and or bear the brunt of the harms of our drug responses, including arrests, incarceration, and general punitive responses. And so we would like to see in the proposals how you are identifying and understanding the inequities and how they're showing up within your specific counties, your specific jurisdictions, and how you are thinking about them, how you are dialoguing about them, and how you seek to identify them, track them, and address them as they come up. So I also encourage you to look at the Racial Equity Alliance, Racial Equity Toolkit. We are also have been integrating this into our work as well, and we find it very helpful. And so again, this webinar and slides will be posted for you to be able to identify and to use that resource and go to this link. Next slide. Again, I've talked about this last summer, but quickly, this is what we mean by a harm reduction approach to drug use. To summarize, you can look up harm reduction, online and see different variations of how it is defined. But these are the common principles that we often see come up again and again in harm reduction work and should be integrated in the proposals. At the core, the basic point we are looking for in your proposal is how are you helping and supporting people who use drugs? Not necessarily just people in recovery, not necessarily people who are absent or sober, but how are you helping in this work going to help and support people who are actively using drugs? And how are you supporting people without administering harm, unintentional or otherwise? So how are you ensuring that services are low barriers, low threshold, that they're easy and accessible, that they're not cumbersome, and that they're appealing, and that people who use drugs or people who are vulnerable to overdose will access them, will want to access them. And as you know, a big component of that and with harm reduction is that they are non-stigmatizing and that there is no threat of punishment. And so we want to be sure to emphasize that in the design of your work, that this is core to the work that you are proposing to do. Next slide. So with that, the framework and how you incorporate it and how your activities and goals, objectives, and deliverables align with the framework, and again, don't work at cross purposes to this framework, will be a part of the scoring criteria. And these are the scales, and these are the questions that the reviewers will keep in mind. Vital Strategies team will be a reviewer, and we'll also be asking Pip Peru to assist in the reviewing. And again, I just want to remind folks that we will also, as we receive proposals, there may be opportunities for us to submit suggestions to amend or revise your proposal. So there are still opportunities to strengthen and provide technical assistance during the process and upon submission to your proposal. We are not here to be punitive or play gotcha games. We really want to support you in developing strong proposals. And so we hope that I'll get more into this scoring algorithm and open up questions, but the detailed algorithm is also in the RFP. So please, in the appendix, so please look at that and use that as your guide, as we will be using that as our guide in our reviewing. Next slide. So getting into the activities that we are actually supporting, your proposal has to be aligned with one of these activities. That is baseline. If your activities you are proposing are not in line in one, is not within one of these buckets, is not a viable proposal. And so you may also choose more than one, but I do want to caution that it's only $50,000 over 12 months, so feasibility has to be clear. It is important that we understand and see that what you're proposing can feasibly be implemented under the budget, under your capacity that you know, and under the resources that you have, or that the budget will support you in acquiring. I don't want to go too much into detail. Again, there is detail in the RFP for each of these of what we mean by each of these. And then at the end of this webinar, there are links to resources that can help you develop what these activities could look like. But again, if you have questions, please ask early, and we can help assist you better inform you on how you can. Yes, the slides will be available. But please ask questions, even if you have questions on how to go about selecting one of these or designing the Pitt Peru technical assistant providers and value strategies can be a resource. And we welcome innovation and creativity also. There is literature and there's guidance that we'll be giving on different approaches that have been done before, but we welcome new ideas and new models and hybrids of models. So please, we do encourage innovation, creativity, as long as they're within these buckets. And also we do, part of our scoring mechanism is the evidence. What is it evidence-based? Evidence or evidence-driven, I should say. Next slide. So within those 4 buckets, naloxone distribution, syringe service programs, diversion, and leave behind naloxone, you can choose to either submit a proposal that is direct service, so actually implementing these buckets, so actually implementing naloxone distribution or syringe services or diversion or leave behind. And so, or even if you have already begun implementing them through your coalition, this is an opportunity where we could support you in expanding your services and expanding your reach and expanding your volume, expanding the services included within these programs. If you want to expand on the wraparound services or the operations or the hours or the how many patients you want to be able to engage. So these are things to think about for project implementation within these. And for planning and capacity building, this work is really laying the groundwork that could really feasibly, realistically lead to actual implementation. And these aren't mutually exclusive. We understand and expect that some capacity or coalition building activities will be included in project implementation. So even if you are implementing a service, a direct service, we do expect that there will be proposals where there will be coalition engagement activities, there might be some training activities included that. So these aren't mutually exclusive from each other. We are also happy and are open and looking and prioritizing planning and capacity building projects that for the most part are planning capacity, but if you intend for that to develop into a service before the end of the project and would like to build that into the work plan and the budget and your general scope of work, that is also welcome and encouraged. Again, we would ideally like to see all of this work develop into implementation and expansion. So even if your proposal is primarily a planning and capacity building project, if you are very realistically seeking to have implementation done, those are acceptable proposals and acceptable to be incorporated into your budget and plans, and we encourage and support those. Next slide. Wait, can you go back? Okay, so going into the actual, so there we go, yes, I'm sorry. Veronica, back one more? Okay, yes, so I do want to touch on one of the components just to give you an example of what the work can potentially look like. So for example, if you're choosing to do syringe service programs, for one, there are toolkits and guidance documents available, and again, I'll provide links at the end to help with development and implementation of SSPs. You can also look at experts in your community and within your county and within your coalitions, and we encourage the inclusion of harm reductionists in your work. And for syringe service programs, we know that there are syringe service program providers at various stages throughout Pennsylvania. And so we will be looking to see if they are included in your agency capacity, if they are a part of decision-making, a part of your expertise, a part of your development process. And so we highly encourage the inclusion of folks who are locally doing this work, local harm reductionists. And as far as planning capacity, site visits and getting technical assistance can be a part of your activities, and we could support that in various ways. Site visits to establish syringe service programs are encouraged. Prevention Point Philly, Prevention Point Pittsburgh are partners that we have. And so if part of the activities, both in implementation and capacity building, you wanna acquire more expertise or see ways in which these programs are rolled out, we can support that and assist in that, and that can be part of your activities. Community education, community engagement is very important to both the implementation of syringe service programs, the planning of syringe service programs, and the expansion of syringe programs. All across the country, syringe service programs, and also here in Pennsylvania, almost always have a community engagement and education plan. We have to acknowledge that there is stigma, there is NIMBYism, not in my backyard, and there is just communities and populations, people that don't understand how this is such a critical and necessary need to harm reduction, to overdose prevention. So whether it's implementation or planning, we do emphasize the use of coalition building, activities related to coalition building, community mobilization, community education, to counteract the stigma and to build understanding of this work, and to generally generate buy-in and support from the community and from stakeholders and from decision makers. So we do encourage community-based activities to that effect. We cannot support any lobbying activities. We may even consider having, once we have administered the funds, maybe some training to elucidate more on what we mean by lobbying and what is and isn't and what kind of toes the line. However, education on syringes and education on the issue areas like syringes and harm reduction is acceptable and does not constitute lobbying. So it's when you start discussing legislation and specific statutes and positions on that legislation that it gets into the lobbying area. So we want to avoid that, and so in your proposals, please be clear that you are doing education and mobilizing and even advocacy, but that lobbying cannot be supported. And so this is also why we noted that as an example of a capacity building activity, you could develop a model ordinance, which is not technically lobbying. You're not developing an actual legislation or pushing for its implementation, but we see this in the development of a model ordinance or the development of operations plan as a fantastic tool to an exercise to spur dialogue, to get stakeholders at the table, to really engage leaders in the community, and to start putting on paper a vision of what the coalition and partnership can achieve. So developing policies and procedures, developing what operations will look like, developing a budget. We find these to be very useful exercises and very real exercises that can help inform, to build buy-in, and really show to the community and to decision makers what it takes to develop programs like a syringe or if it's a diversion program as well, and really start making it a realistic goal of how it could be, and really start painting the picture and the roadmap of how these things can be implemented. So there are ways to do education and to start discussing what an ordinance can look like without going into the area of lobbying. If you have lobbying capabilities outside of this grant and outside of this grant parameters, good for you, but none of the funding can touch those activities. So any FTE that's supported by this grant cannot be allocated to lobbying, but if you have other FTE or staffing that is not supported by this grant, that is up to you to decide on how to use that, including lobbying. It's just whatever resources we are putting into this grant is what needs to be very clearly restricted from lobbying. Next slide. So now proposal requirements. A lot of detail is in the RFP here. And then again, I urge you to look at the scoring algorithm because it gets into the questions for each of these. So agency capacity, emphasizing partnerships. And again, we really want to see where you are able to have harm reduction service providers at the table, a part of the decision making, because they bring a lot of resources, a lot of expertise. And we do have a sense of who the harm reduction providers are in Pennsylvania. And so we will be looking to see whether they're included in this work and the level of inclusion that they are, whether it's from a budget perspective, staffing, leadership. So that is something that we will be looking out for. And the same goes for people with lived experiences, including people with active drug use. We're very interested in supporting proposals that are very intentional and have a track record or have future intentions of including people with active drug use, whether from a consultative perspective, an expertise perspective, a decision-making perspective. People who use drugs have a lot of knowledge, and they're the population that you seek to serve. So it makes sense that they should be a part of the process in various ways. And so we will be looking to see how harm reductionists and people with lived experiences and people who do this work are a part of the capacity that you are bringing to this work. I'm going to briefly on the work plan that goes at the steps, the actual steps and the timeline and deliverables that you are laying out over the course of the 12 months. Again, looking at how harm reduction and people with experiences will be incorporated and the responsibilities and the roles that they will play. Evaluation, data collection is important, and the use of data over the course of the project is valuable. So we want to see, are you making, what is the baseline data and the baseline landscape that you are working with, and then what are your metric goals? What do you seek to achieve from a data perspective? And then also, we want to just hear a little bit how you're thinking about using the data. How can we make the data actionable? I know PIPRU has provided TA on this, and we will also be available to provide TA on this. So this doesn't have to be a complex evaluation proposal, but we want to see that you are thinking about it. We want to see what data that you have accessible, and we want to see how you've been using the data and how you plan to use the data. So again, nothing too complicated, but we want to see that this is a part of your process. And as we provide grants and accept proposals over the course of implementation, we again will be available and able to provide technical assistance around this piece, particularly the evaluation. We are partners with the Johns Hopkins Bloomberg School of Public Health, and they are assisting us in our evaluation activities throughout the course of the project. And so we will be able to lend that technical assistance to you over the course of this work. We are also able to provide TA in all different aspects. Working with PIPRU, we are slated to do a number of harm reduction oriented webinars. And then based on your feedback, we may decide that there are additional webinars that might be useful, whether it's around advocacy or community engagement, or like I said, lobbying, or like how to engage people with lived experiences, etc. So I just emphasize over and over that we don't want to make this process too onerous. We do want to see that you're thoughtful, and again, we can provide feedback, but in it not being too onerous, we also want to note that we will be helping throughout the process, post proposal submissions and throughout the implementation process. Letters of support are optional, but can be strategically used to bolster any of these key areas, whether it's agency capacity, a letter of support from from different entities that are not part of the coalition or are part of the coalition, could be valuable. So if you're doing naloxone leave behind, letters of support from your emergency medical service partner, or if you're choosing to do diversion or syringes, letter of support from different public safety law enforcement entities can be very useful, because we will be looking at feasibility. And so where feasibility may not be coming clear when in your project narrative, a letter of support can add to that. Because also we don't want the project narratives to be too long, and so letters of support can be another avenue to augment the brevity that we are expecting with the narrative. So it can be strategically used, please keep it in mind, but we also recognize that we don't have a lot of time, and so that's why we put it as optional. Next slide. So the scope of work is broken down even further, and this is a lot of the scope of work is where we're going to see a lot of aligns with the evaluation criteria we're going to have for the proposal. So, for example, how committed you are to the framework. We should, especially the equity framework, there is a section in the scope of work that you should provide a few sentences on of how you are thinking about equity, how you are identifying and tracking equity, and then how you are thinking about addressing equity. We want the projects, we want to be sure the need statement, we want to be sure that there is a need, a clear gap that is being filled. We want what are the main activities you'll be focused on, not just the domain, but what is the thrust, what is the thrust of what you're actually going to do. Resources, what are resources you have and will acquire, and what are resources that this budget will augment. And there are resources we would expect you to have, but understand that this actually varies by county. So for example, if you put naloxone in your budget, but there is a centralized coordinating entity in your jurisdiction, we understand that there are barriers, but we would like to see somewhere in your proposal just the rationale. So whether it's in the budget or whether in narrative, we want a clear understanding of what resources are already in your community, what resources have barriers to accessing, and then what is the rationale for your budget ask for additional resources. Population, who are you serving, but also why? Is it clear that this is the population most affected? And how do you plan to reach this population? What are your recruitment and your engagement what's your recruitment engagement strategy or activities that you plan to implement? Same for a jurisdiction. Is it clear that this is an area impacted at risk? Are you addressing the entire county, or is it a specific municipality within the county? And why? What is your rationale for that? Racial equity, how are you ensuring equitable access to the benefits of your program? And how are you avoiding harms and collateral consequences that could be harmful to people of color? These are very it's a population, and drug use is highly stigmatized. So how are we ensuring that you're not jeopardizing anonymity or jeopardizing folks by exposing them to law enforcement or punishment? Same goes, engagement here could look like engagement with community-based organizations. From a racial equity perspective, what are community organizations that serve people of color? They can be brought in as partners. How are you, perhaps if there's a non-English speaking population within your jurisdiction, how are you addressing and accessing and being accessible to that population? How are you thinking about placement of services? Is it in neighborhoods where the population most affected lives? So these are different things to think about when you think about equity. Where are your services? How are you accessing these folks? Who are you engaging? And then sustainability. Again, the work that we do throughout Pennsylvania, throughout this 3 years, we want to make sure that it's impactful and lasts, and that there is momentum for work to continue to build. And so with that, we should see clear deliverables that show how this work can carry momentum past the project period, especially if you're doing capacity building and planning project. What is the plan to support implementation after that funding period? What is the plan to make sure that that work continues and that it doesn't just end when the funding period ends? For projects centered on coalition capacity building, yes, again, sustainability plans must address how the coalition plans to continue efforts towards implementation following the end of the project period. But again, capacity building projects that can also begin implementation before the end of the project period. And so we are very happy to support projects that kind of have a hybrid of capacity building and direct service. So those are projects that we will be considering as well. Next slide. So budget parameters, I just wanted to give you some examples of things that could be put in the budget. They have to be directly related to the project activities that you are proposing. So not indirect costs and not general operating support. Staffing, direct service to individuals, what is their role in the project? Is it staff that supports the project activities? Consultants and technical assistants and trainings can be a part of the budget. Event space, community engagement activities we recognize require event spaces. Trainings require spaces, and so event space and other costs are acceptable. Equipment and supplies are acceptable. A note again, naloxone, we know that naloxone is accessible for some, not all, and perhaps not the volume that people need, but we do know that there is a structure within Pennsylvania, within counties, through the centralized coordinating entities that provide naloxone. And so if you are requesting budget funding for the purchase of naloxone, we would like to see the rationale of why the CCE isn't filling that gap. And we could also, it's also acceptable to request funding for purchase of syringes as well for syringe service program. and then travel, office, etc. All of these are acceptable as long as it relates to the project activities. Next slide. And so this is to emphasize just that how your budget is laid out and is it appropriate, feasible, and focused is part of the scoring algorithm. And so it definitely has to be clear that the budget makes sense and that the budget is adequate. The budget, along with the resources already available that you identify in your scope of work, that all together, it shows feasibility in implementing the actual activities that you are proposing, that they are realistic. When we look at the whole picture of the budget and the resources and the actual activities we want to see like these, we'll be looking at how realistic and feasible it is to execute. Next slide. So this is the full algorithm. Again, it is in the RFP, and with this level of detail. So this is for me to just again emphasize, please read it carefully. Please look at the scale. As you can see, each one ranges from 1 to 15, 15 being the highest for scope of work, because the scope of work really gets into the thrust of what it is that you want to do, and so we find that to be the most important. So please think very carefully about this and see and try to address each one of these domains. Next slide. So I think that's, again, just looking back at the timeline, that's pretty much all the overview that I have. We do encourage you to circulate this amongst your coalition members. They could be a great resource, and we just really want to see and be supportive in receiving really great proposals. We really want to get this money out the door, and we really want to have this money targeted to supporting the coalition work that you've already done, and just and expanding it and really bringing in harm reduction across Pennsylvania. So these are the deadlines again. Veronica, that is the email where you could submit the application as well as any questions you have. And once again, PIP Peru, great resource, please use them. Next slide. And so when we post this, these are some links that you could go to. There are many, many more out there, but Harm Reduction Coalition, that site in and of itself has several links, lots of webinars, pre-arrest, pre-booking diversion. The National Law Enforcement Assistant Diversion Bureau has a lot of written materials on planning and capacity building, as well as could be a guidance on how to actually implement this stuff. CDC has guidance documents with syringe services. Yeah, again, the Racial Equity Toolkit. We've been finding it very helpful in our work, and so we encourage you to use that in your work as well. And with that, I think I'm going to open it with any questions. I see my colleagues are also on, so they are always available to jump in if I've missed anything or they just want to add their own comments. I see Veronica and Alejandro are both on. And I don't see any questions in the chat box, so I guess we're going to go to opening up the audio for folks. Which I don't even know if I know how to do that. If people want to raise their hands or submit questions to the chat, now would be a time. Now would be the time to do that. Any questions? If you are having trouble with audio or would like to be unmuted, please submit something to the chat. Or if you are having any technical difficulties, please submit something to the chat or the Q&A. I want to make sure that I am answering any questions and that people don't leave here with still having questions to the RFP. Again, this will be posted online and we will be sending the link out to everybody to access these. All right. Besides racial equity, can rural equity be considered? Yes, we have racial equity, but then I think if you go up, health equity is also a part of our framework. And so health equity acknowledges that there are other identities and status and marginalized populations. So rural equity is we do want to see the rationale and the data and how you are characterizing inequities by urbanicity and how you seek to address them. So health equity for all populations that are not equally accessing services or having unequal outcomes related to drug use is appropriate to discuss and address. Any other questions? I think everybody has the ability to unmute themselves and discuss, or let's see. Okay. I'm not seeing any more questions. Really appreciate everyone attending. If I'm not seeing any more questions or comments, would you entertain an application that demonstrates a strong relationship with law enforcement for a diversion program in which law enforcement would not be in favor of syringe needle exchange? If your domain is the pre-arrest, pre-booking diversion, if that is the harm reduction activity you seek to work on, then it is fine if they are not on board with syringes, because syringe service programs is not going to be the activity that you will be proposing. So we understand, and we've seen it from the surveys, that law enforcement acceptance, the community acceptance across these three domains varies widely. So we understand that everyone is not going to be on board with all of the things. But if your application is specifically law enforcement assisted diversion, then law enforcement as far as feasibility, it would make sense that law enforcement would be a clear partner and supportive of that activity. Their position on syringes will be we'll consider unrelated to the diversion. We understand again that all people aren't supportive of all things, and so we do. If your focus is diversion, that will be where the proposal should be focused on, and where letters of support or agency capacity and resources should be focused on. So yes, we will look at applications that demonstrate a diversion support, even though syringe support may not be there. May we ask for supply monies to increase the amount of people we are able to reach as well? Yes. So with regard to capacity building, may we ask for supply monies to increase the amount of people we are able to reach, as well as for supplies we do not currently have? Yes, even if your proposal is primarily a capacity building project, but you are still allowed to incorporate implementation activities. And so if you are incorporating implementation activities with your capacity building project, it is appropriate to ask for funding to support supplies to support that implementation set of work. Again, these aren't mutually exclusive activities. We aren't putting a bright, rigid line between the two. We understand that there are ways and strategies, and it can be very strategic and useful to kind of meld the different activities to work on more than one activity or to meld implementation with capacity building and planning. So we do not have a rigid, bright line that you could do one but not the other. So yes, if there's a part of your activities, asking for supplies makes sense, especially if you're doing expanding your scope of services. Any other questions? Does the RFP require that needle exchange programs be included as a harm reduction strategy? You do not have to choose needle exchange as your activity. You can focus primarily on naloxone distribution to peer networks, to peers and peer networks. You can focus exclusively on diversion. You can focus exclusively on EMS leave behind. You do not have to spread yourself thin or focus on more than one. So again, we understand that not all stakeholders and coalitions communities are supportive of all 4 of these activities. So it makes sense if you do the one that's most feasible or that is most realistic to gain buy-in. Other questions? Okay, so I guess we're gonna wrap up a little bit early. Again, Veronica's email is there. Please send her all questions that you have. And please use Pip Peru as a resource. Please use us as a resource. We really don't want to make this process cumbersome. We want to give you the money. And we really want to make sure that we're supporting meaningful work. So we're here as a resource, and even upon submission, I do want to just highlight again that there may be instances where we request or have dialogue around potential revisions or changes, all in the vein of strengthening the work and your application. So yes, so that is a possibility that we will have input in how to improve your proposal. And I do want to go back to again emphasize that we for COVID-19, we recognize how the landscape is changing. Even with openings, we understand that there could be new waves and closures and stay-at-home orders can be implemented once again. So all of that is definitely on our radar. And if you have questions about COVID-19, please, or concerns, please submit those as well. All right, so unless I hear any other last minute questions or hands raised or concerns, I think we're going to close off this webinar and wish you good luck, and we're here if you need us. All right. All right, thank you everybody. I am now ending the webinar. Thank you for coming, and hope to see your proposals very soon. Bye-bye now.